You know, during the height of the pandemic, many healthcare providers were having pregnant patients do virtual checkups unless they were high risk or at a point in their pregnancy where they had to be seen. In this morning's STL Moms Report, Fox 2's Molly Rose is talking with a doctor who says it's time for pregnant patients to get back into the doctor's office. Molly?
Yeah, that is the message. And this morning we are joined by Dr. Najat Al-Shari, an OB-GYN with SSM Health Medical Group. Doctor, thank you for being with us this morning.
Thank you so much for having me.
So we know there was that pause in some women coming in for appointments, and for a while, spouses weren't allowed. What has changed? Is everybody allowed to come back in now for these prenatal appointments?
Yeah, so absolutely. We definitely at the beginning of the pandemic did see a significant drop in the number of women coming in. I think a lot of that was the unknowns of COVID-19. But now that the pandemic has evolved and we've learned more and more and more, as well as implemented various safety protocols along the region, we're definitely encouraging our women to come back in.
How often should a woman be seen during pregnancy, and does that change depending on maybe where they are in the pregnancy, their age, their risk factors?
Yes, absolutely. So as you said, every patient is different. Every patient is unique. But assuming an overall uncomplicated pregnancy, we'd recommend that women come in about every 4 weeks until about 28 weeks or 7 months pregnancy. And then between 28 to 36 weeks, it's approximately every 2 to 3 weeks. And then 36 weeks, we'd recommend coming at least weekly.
Probably a relief for women to get back into the doctor's office and get seen while pregnant. I know there's been a lot of changes as far as delivery goes. For quite some time, there were visitor restrictions, things like that at the hospital. What's the latest information on if you are going to be giving birth? Can you have grandma and grandpa come up to the delivery room after, or how does that work now?
Yeah, so each and every day the guidelines and recommendations are changing as we continue to assess numbers and development of cases within the region. As of right now, we allow one support person to come in at a time with the mom. That support person can change out with another person, but we're really, we have to remember that part of limiting cases and exposure is, limiting that social distancing.
And what would be the message that you want to give to women who they are still feeling a little hesitant, maybe they're not making all the appointments? What would you say to them?
Yes, so I think it's so important that women remember that our prenatal visits are structured and designed along a tried and true timeline. And that tried and true timeline is there to make sure that we're tracking various milestones and developments within your baby's pregnancy, or within your baby and your pregnancy, to ensure that you are developing appropriately. So when you're missing out on your prenatal visits, we're missing out on these potential opportunities to intervene early and optimize our outcome of a healthy mom and a healthy baby.
Well, we appreciate all that information, Dr. Al-Shari. Thank you for your time. We will, of course, link this segment online for anybody interested. That'll be on fox2now.com.